Well, as COVID and flu cases increase, the World Health Organization and the Centers for Disease Control and Prevention is issuing a warning about yet another imminent threat.
Yeah, that's right. 11 Alive's Bobeth Yates takes a look at a recent report that now says measles is showing up in every region of the planet, and the cases are expected to rise.
That's right. Officials say measles is one of the most contagious human viruses, and it's making a comeback with 9 million cases, resulting in more than 128,000 deaths globally last year. And officials say COVID is partly to blame.
One of the many unintended consequences of the COVID pandemic is children and families have fallen behind their vaccination schedules.
Physician Katrina Gibson says with more people missing their shots, there has been an uptick in measles cases. And a recent report from the World Health Organization and the Center for Disease Control warns the illness is now an imminent global threat, saying they've seen an 83% increase in cases since 2020.
We're starting to see outbreaks in sub-Saharan Africa, Columbus, Ohio, and what with international travel, particularly as the holiday seasons are upon us, in addition to having the opportunity to have more contact with family and friends. Unfortunately, this can also put us at higher risk for infectious disease.
Dr. Gibson says while vaccination is the best form of protection against the virus, people should also avoid large gatherings, wash their hands, and wear a mask to help stop the spread. And she warns of symptoms.
Fevers, conjunctivitis or red eye, cough, runny nose, or a rash that tends to start at the hairline and spread down to the rest of the body. These are all signs and symptoms that are concerning for measles. If you have these symptoms, you should isolate and get in touch with your primary care physician.
As of last week, the CDC says there are more than 55 cases of measles in 5 districts.